So, in this episode, we're going to be learning about Dr. Bryan's crisis response planning method. He is the stress, trauma, and resilience professor of psychiatry and behavioral health at the Ohio State University College of Medicine, among many other titles. Dr. Bryan conducts research to help military veterans, first responders, and other adults who are dealing with mental health issues.
Just by happenstance, when I went to graduate school, the training director at that time was David Rudd, who is a very prominent suicide researcher himself. Another important turning point, of course, was 9/11. I started graduate school in 2002. I remember the morning of the invasion of Iraq, our instructor said, let's talk about this. Let's talk about what's happening in the world. He was close to retirement. He had lived through Vietnam and through Korea, and said, there are consequences of war, and they're not always physical. And as future psychologists, you all will play an important role in helping a very small number of our society to carry this burden. Over the next few years, having this training director, David Rudd, who was a former Army psychologist, encouraging me to join the military. When it came to the point to apply for internships, the military was one of those options. I looked into it, and a few years after that, I found myself in Iraq. Very transformative experience for me. It really changed how I understand suicide, how I think about it, definitely how I approach working with military personnel and veterans. When you're deployed to Iraq, you think of something like trauma. The things that I'm talking about with service members happened a few hours ago, not years ago. You're in an intensive care unit, talking with very severely injured people who have survived explosions, blasts, gunfights. It's just different. There was a visceral rawness to it that really kind of shifted my thinking about what we're doing to help people who experience trauma. When service members would die by suicide, they were brought to our hospital. And there was just something about being in the unit one day, just kind of seeing it. They were all gunshot wounds, and just the brutality of firearm suicide. As a psychologist, suicides happen somewhere else. And so oftentimes we as mental health professionals don't actually, I think, come face to face with that level of violence. And so I think that definitely had an effect on me.